Welcome to Deeply Disturbing Things.
The podcast.
I cannot have the mouse over my face that whole time. That's it, drive me crazy.
I wonder if that shows on the recording.
Just for me. When I look at it, I'm gonna think there's something on my face, like a bug. Welcome to Deeply Disturbing Things.
The podcast.
I'm Macy,
And I'm Naomi.
and we are two anxious counselors who like to talk about deeply disturbing things, and we do things with our hands sometimes.
I really like to hand
I
dance.
saw you do it, and I did the mirror neuron thing and started doing it too, but then I was confused about what was happening.
You know, it's just spontaneous hand dancing that just comes
Ooh,
out
if
sometimes.
that's not the title of this, it might actually fit. Spontaneous hand dancing.
Okay, I cannot wait to hear what you have for our
I mean,
topic.
it certainly doesn't seem like it should, but I think it might.
Everything's connected.
All right, I'm gonna talk about, and this is a local and a wider scale issue, but starting off on the local level with Spokane's major crisis of overdoses of fentanyl. Yes. So hand dancing relative to drug use, but that's loosely associated.
Okay.
Yeah, I don't know. Usually it's like maybe looking for something on the ground on the street. That's usually what I tend to see when I drive by.
I see people shitting on my lawn. That's what I see. A lot of that.
Was that those stuff in the back, like in the backyard?
No, that was my front yard.
That happened recently?
No, that was last summer, but it still stings.
Her lawn does not look like a toilet, just to be clear. You have a very nice lawn.
Thank you.
You're welcome. I would not mistake it for a toilet. Did they use toilet paper?
No.
They never do. It's usually a leaf, and you don't have a tree there anymore. I mean, those pine trees.
They also, on the same day that they were doing fentanyl and shitting in my yard, they cut my hose up into little bits.
What?
I know.
For drugs?
Yeah.
They're just supposed to drink water out of it. That's the like.
And I love that
neighbors.
hose. That hose came with the house. That was like an old school
like
hose.
the like lighter green.
The light green.
Yeah, yeah. I know that hose.
Rolled up really easily. It's gonna take years for my new hose to get like
all, yeah, they're all flexible.
Stiff. Yeah, no, it's all stiff.
I have one of those cloth ones that like does it like deflates. Like,
does it make a sound?
just like that.
I don't think I'm familiar with the cloth hose.
No, I still haven't fixed my plumbing since it exploded this winter. I just have not turned on the outside water and letting my lawn die. A slow death. It's just not worth the whatever it's called when they come out to like, I don't know, appraise it. The water people.
What are you
The
talking
fixers from plumbing? I don't know.
Oh, it's broken?
Well, the outside exploded.
Oh.
Yeah. When it like melted. Anyways, somehow we're way off track. All right. So.
Or maybe quite on track. We'll see.
Who knows? Everything's connected.
Exactly.
So there is a public and safety briefing that was actually so this was just this March that they had this briefing that gave the overall picture of what this drug crisis looks like in our community. And this isn't unique to our community, with other communities also being worse in some areas, often in some bigger cities, but rural areas are also impacted.
Well, Spokane's a small, big city. Like, we have big city problems just in a very condensed area.
Right, yeah. And Dr. Bob Lutz, who's still there, by the way, Washington Department of Health. There was like the whole controversy thing with him and people not wanting during COVIDs, I think.
Yeah.
That's the only time I saw his name.
Yeah, he got fired, I think, from our
Did he?
Local city health dealia. I think he works for the state now.
Oh, yeah, because it's Washington Department of Health.
Yeah, I think he got fired from our county level or city level. I didn't follow the drama too closely.
Obviously,
but I do remember he got fired. And then I saw him speak last summer after the firing at some suicide prevention event.
Was it good?
He was the only one in the whole place wearing a COVID mask, and I thought it was very pointed.
I felt it was intentional.
It was totally intentional.
So this was presented to him and other council members to show the drastic rise in overdoses and drug deaths. And in nearly every example, Spokane County's numbers exceeded those of the state. So we are now higher than the state's average, which is honestly shocking to me, with Seattle being like the big city epicenter.
Well, I think part of it is you can't find heroin in Spokane. And so fentanyl is easily accessible and super cheap.
Yeah, easy to make, I guess, refined. I don't know.
Well, it's not made here. This is all cartel. Yeah. I mean, our
Yeah.
fentanyl overdose deaths have increased fourfold in the last 2 years. It's really
Right.
sad. And one of my friends actually, her son, was unfortunately found dead in the recent months. It just, if you're out on the street, you're probably gonna die of fentanyl.
And in this research, I did find, I'll just say at the beginning of this, in case you decide you don't want to keep listening, you leave. Washington State does offer free Narcan that you can order, and it can be sent to you, as well as like fentanyl testing has been actually just fairly recently approved in Washington State. So it's not a purity test, but if you have other drugs that you use, you can use that to test it to make sure it doesn't have fentanyl in it. It's like 99% accurate, because a lot of these are people using other drugs that have been laced with fentanyl and then they're not aware of it, and it can be deadly. So those are also accessible.
I think fentanyl's super scary.
It
I did a
is very
fentanyl topic
scary.
a while back, but I honestly don't remember a lot of the deets.
I remember, yeah, no, I remember you did the topic where they were like doing the
candy.
Yeah.
Yeah, it was a Halloween episode.
No, not the candy one.
No, it was about fentanyl candy.
Oh, that's right, that's right. Because it came in all the different colors.
Yeah.
I do remember that.
Pretty deadly.
Pretty
That
deadly.
used to be my roller derby team.
Pretty Deadlies. Yeah, I saw a picture of you in Pretty Deadlies not that long ago. It's a nice flashback.
It started up as a pinup thing, but then turned into zombies.
Right.
As things do.
I have actually, I cleaned, I was at my dad's house cleaning an ant horde that took over the garage, by the way.
Was it one of those weird pile things?
Yeah, but like in the walls.
Oh, that sounds bad.
Horrifying. It was horrifying.
Those ant piles are really interesting. I don't know anything about them, but they're freaky.
Oh, the ones that like overflow.
Like you might see them on the sidewalk, like
Right.
sometime, like billions of ants just like
Right.
in this one little pile.
Right.
Is that not what you're talking about?
Now I have no idea what I'm talking about. What was I doing?
Ant horde in the wall.
Slightly prior to that.
Fentanyl.
Went to my dad's, and yeah, that's unrelated. I don't know. Anyway, oh yeah, no, I found a Pretty Deadly jersey that I had that had Wound Punch 21, I think from way back something. I guess skated something. I must have.
You must have. That's fun.
I don't know.
Love it.
Yeah.
This is a good old days.
Anyways, yes. So one graphic that was presented showed that overdose deaths for synthetic opioids, the ones that are made that like your topic was focused on, such as fentanyl, between 2019 and 2022 skyrocketed 2,000%.
Yeah, it's terrifying.
2,000%.
It's so cheap.
What does that even mean, 2,000%?
It's so addictive. It's so deadly. It's terrifying. And my little like kitchen window looks out right there at a very popular fentanyl stop and use spot. So it's
this is a
all
prime area. I'm in the valley, I'm on a dead end suburb, so I don't really see it.
In my alley, because here's two things. First of all, it's an alley, so it's like off the main street. Second of all, the neighbors built this really nice new concrete wall. Perfect counter height, so everyone can do there. But what's really attractive about my alley is there's this space, like
She's selling it to you right now.
about a foot wide between the neighbors' garages,
Uh-huh.
and that's where shit goes down all the
Oh.
time.
Where you can't be seen. Oh, actually, so yeah, this my office, there we have like a back stairwell and I go back there frequently and there'll be foils and like paraphernalia just kind of scattered down the stairs because it's the one spot that you can't really be seen.
Yeah, the damn foils, they blow into my yard. I honestly am planning on making a fence on the front between the alley and my yard because
And
of all the
you do live in a
fentanyl
prime
particles.
area that can happen. It's not like you're
I mean, I have to go out there with like my reaching stick and like throw away foils all the time that are blowing into my front yard.
recently got a reaching stick and
Just recently? How have you lived?
I haven't reached for it yet.
Oh my gosh, I reach all the time. You know what I use mine for a lot? Is the socks that fall behind the dryer.
That's great.
I know, cause I was
Oh my
like
God.
back there, I'm
I
like,
just
damn
did
it, how am I
that.
ever gonna get that?
There's stuff back there.
Reaching stick,
Wow.
cause you don't wanna reach back there with your
You
hand.
don't. I feel like this episode has so many great in-betweens that people are just gonna get some solid takeaways.
I get a reaching stick.
Get a reaching stick.
Honestly, you can't live without one.
Get a reaching stick and
And a fence.
and
Sadly,
hit someone with consent and roller derby.
yeah. I mean, I hate that fences have become like my solution, but
I know.
I've had to build
That's why you guys are
massive
like,
fences.
that's not you, but it is this area. You need.
Well, I never had to before, think about it, and
No.
now I'm like, more fences, I have to.
I have gotten more and more, there is definitely more increased traffic in the valley of foot walkers. I'm just gonna say that word. That I made up, foot walkers.
Like it, it's like day walkers.
Yeah, 'cause like in the valley, you don't expect it because it is spread out. We're not near like town and I'm like off Pines the other direction, so there's no stores or anything. You don't expect much foot traffic. There you go.
Foot walkers.
Yeah, so the foot walkers, where you're like, where are you going? Like, I don't think you live around here.
Oh,
Where
that's like everybody.
Yeah, yeah.
Everybody.
Yeah, and it's just more noticeable there because you don't see it. And I'm like, I live on a dead end street. Where you going? Don't look at my garage. Don't you do it.
Yeah, and you know, I try not to be like making assumptions about people, because some people are just doing their thing, but some people are shitting in my yard and leaving fentanyl foil, so
And
those are the
ruining
ones.
it for everyone.
Those are the ones that are impacting like directly my little happy bubble, so that's where I'm like,
Right.
okay, something has to happen, and I guess it's a fence, because I don't know what else to do.
And we discussed earlier happy bubbles.
I
and
do have
addressing happy
Narcan in my
bubbles.
house, and I would
I have a
intervene.
Narcan.
Well,
Oh my
you have
God.
to have like 4 or 5.
I-
They say the level of fentanyl, like the users around Spokane, it's gonna take 4 or 5 to revive them.
Oh, gotcha.
Yeah, it's gonna be a one and done, but I would intervene if I saw somebody out my kitchen window.
Well, and actually, yeah, no, I went on a bike ride yesterday with Cody and this car pulls up in front of us so it was just getting dark and this girl just starts throwing up out the window and the other girl's like laughing, the driver, she's like, but she said something and it was like clear it was drugs, not alcohol and she was like, you'll be fine, and we were already like, whoa, like you should call someone, like, because now it's just so dangerous. If you're already reacting by like throwing up and it's drug related, like your body's not okay. You're not okay.
Okay.
Okay. You're not okay. Okay, so preliminary numbers so this was in 2023. Okay, because they're slow getting data. 2023 numbers were that the OD deaths, overdose deaths for all drugs rose from 2,703, and this is just here, to 3,130. That's too many. So that included a rise in cocaine overdoses, 361 up to 549, which surprised council member Michael Cathart. Let's say the numbers do not account for polysubstance overdoses or users mixing different drugs. So that none of that even equates to mix. This rise has called for action in our community with Betsy Wilkerson saying that it's an emergency. And we
I
need
love
to
Betsy.
declare it an emergency. However, they said we don't have the resources to do that, which is a problem.
I do like Betsy Wilkerson. Shout out, Betsy. I voted for you.
Shut up, Betsy. We have not enough money, I guess. That and to fix potholes since I moved here and the north-south freeway. Where is the money? Where is the money?
You can actually look up and
No,
it shows
see where
like
it goes.
what tax money goes to.
Yeah.
1% used to, I don't know if
Make me vote.
I don't know if it's the number anymore, but 1% of our taxes used to go to the Spokane Sports Commission that helped fund Spokarnage.
Oh, yeah.
I don't know if it's still 1%.
Also another
but
fun in between.
that used to be the stat.
Yeah.
So some people might say that's a waste of money. Like, I don't care, need my tax dollars supporting roller derby or
Probably
the
not.
volleyball sizzler.
You definitely don't need, people to be happy enjoying themselves.
Well, I mean, everyone has opinions, some people think the levies to support the schools are like super necessary, some people don't.
Yeah, and to me, it's like there's things I don't mind paying for that I don't partake in. Because that's how the world works.
Well,
I mean, I mind paying, but have to.
yeah, I mean, I'm kind of salty about this topic right now.
About taxes.
Yeah, my property taxes on this house that we're sitting in doubled last year, double.
Yeah, no, I owe money I owe money
And
because of it.
honestly, I'm like, I'll figure out like, what is it? Like, I do need to look at the breakdown. How about well, you live in a different city. So Spokane breakdown wouldn't be the
Right.
same as yours, but I
Yours is
do want to
probably
see the
way
breakdown and be like, okay, I don't give an F about this,
Mhm.
and I do vote, but sometimes they bundle things, and so you
They
can't really,
do. And it's
like,
like if you
just
want
pick and
this, you
choose.
also get,
Yeah, like I want a full menu, like I want to be
And
able
does
to
it have to
choose.
come with a person?
No, yeah,
Like, it doesn't have
like
to.
I honestly do not care about the north-south freeway. I think it's been really destructive.
Well, and it's been, and it's taken, like, they obviously didn't have a good plan in the first place that was not prepared for, or the resources.
And those poor people that live you buy a house and you're
freeway.
enjoying it, and all of a sudden the freeway's 2 feet away from your door. Like,
Uh-huh.
when I saw some of those houses that were impacted, I almost cried. Like, it really
When we
upset
see
me
them, like,
and hurt
clear it
me.
out. Mhm.
Yeah, if you go down behind Spokane Community College, see right the new section, it's right
Oh, I've
next to those
seen that.
people's houses.
Right.
Horrible, and the noise and the brake dust and increased cancer rates, and your property values just dropped, and it just makes me so sad. And why?
Just
So
because,
who is using this freeway? This doesn't even connect to
I mean, I
anything.
would probably use it to go to my dad's house, but that's just me, and I would drive there anyways. I do.
Yeah, it doesn't even, like, it's not even connected to downtown. It makes no sense.
Well, it's because to go north-south, to go up that, it's the other highway, but 395, Highway 2. I don't know, it's to get through us, it's like getting rid of Route 66.
Get your kicks on Route 66.
Route 66, right? I mean, there's
Oh,
like newer,
wow.
faster ways. Or route. It's the route to the route.
I hate it all. I just think the destruction is not worth whatever potential payoff may come in 20 years when they finish it.
If they finish it. I seriously, my dad moved here. We moved here my freshman year of high school, and that was one of the selling points that they told him was within 3 years there will be a completed north-south freeway. Right.
Does he have that in writing?
Ha. No, but I do remember it actually vividly being told to him. So
And now he can only hope it's done in his lifetime.
yeah, I think he gave up on that a long time ago. So what was Wilkerson said, Betsy said, we could declare an emergency. We don't have the resources to really double down with additional funding to support intensive outreach or treatment going forward. So that's really disappointing, just resource wise, because that is about actually helping people, like doing the lot more long-term stuff. And really the answer right now is just saying that there's a crisis.
Yeah.
They want to increase awareness, that to open up additional tools.
I mean, we'd have to build so many like inpatient units that we don't have, and it's really hard to ITA somebody for substance use.
Right, it just doesn't like mean that I mean, but it's still happening, you know,
It's so
regardless.
complicated, like it's
Right.
not, I mean, it's like unhoused people, like situation, like it's not like, oh, just do this and it'll
Right.
fix it, like
Right,
it's so
and then
complex.
all of that ends up taking so much time and you get to the point where, oh, a lottery. Oh, okay, like we thought everyone was gonna get helped. Oh no, just after 2 years you may get selected. Maybe. Hard. It's really hard. And you have to be on top of it, and you're expecting people who have a substance addiction to be on top of paperwork and timelines and showing up and being present and without treatment first. That's really just kind of setting people up to fail, or could set people up to fail. And then blame them for it.
Yeah, I mean,
So,
it can get kind of like you feel hopeless and helpless sometimes with
yeah,
these issues, like what can I do? And then it's like, okay,
increase awareness.
focus on what I can do. I got my
Right.
Narcan, I got my kitchen window view.
Yes, yes, yes.
If I ever saw somebody in need out my kitchen window, I would help. I mean, what else can I do, you know?
Yeah. And
I pay my taxes, which goes to something.
I can't even look at I can't even look at that.
I'm actually going to look up and see what the tax
That's a
breakdown
good,
is
I'm
in
curious,
second.
yeah, the city discussed a possible declaration, which I haven't heard yet, I've heard no such declaration of steps to be taken.
What's the date of the declaration?
Well, they didn't give a date, they said that they discussed a possible
Oh,
declaration. And I have not found it. The regional health district said that they have compiled and coordinated an overdose dashboard using comprehensive data. That Crumb 2 News has explored, where Crumb 2 News looked at the lack of centralized data and said it was really difficult to paint a clear picture of the drug problem. So like a lot of what was being posted wasn't very clear or
I mean, how
accurate.
much more clear does the painting need to freaking be?
Yeah, like it's just bad. It's
Yeah,
bad and
it's bad.
it's like way worse.
I don't think this is like an impressionist abstract art.
Like,
Like
oh,
it's pretty
we
photorealism.
like, is there a specific number you're aiming for? Is it 2026 or
I just don't understand that
enough?
statement. It seems pretty crystal clear to me. This is not muddy and vague.
The city is starting to receive opioid abatement money from settlements, which could be used to staff up co-responder or behavioral response units. That money, she said, should continue to come in for many years. I don't know what settlements
Did
is.
somebody get sued?
Well, I'm wondering
That
if like maybe people who are, because that would mean the city's getting money.
The city sued some
What it
entity, maybe?
do they sue people and like their families for overdosing on city property? Is that how this goes around?
Like, I don't understand what that means. How is the city getting settlements?
I don't understand, but I'm gonna actually highlight
I
that.
thought like groups of people could get settlements.
She said that money should come in for many years. I don't know what that means.
Okay, more research needed.
The city is also awaiting a decision from the state on a request for $1 million to expand the street medical team operated by Chaz.
Okay, that doesn't seem like a lot of money actually. But I mean I think that's really important that some of the work is occurring on the streets where you get to know people and from those relationships. I think that's important.
Right.
I do know that there is a serious lack of SUD inpatient places. And I do know it can be challenging to ITA somebody for SUD use. So, I mean, those are big factors.
I don't even know how to spell fentanyl. How do I spell it? P?
F.
Oh, I thought it was a fancy
Fentanyl.
trick me word. Okay.
No,
Oh,
not like phenomenon.
phenomenal. Okay. I'm looking up this thing that the settlements.
Fentanyl settlements.
Okay, so this was as of May 6th.
Okay.
$7.2 million in projects approved for opioid settlement funds. Oh, is it like settlement housing? No, hold on. Let me double check. So this is through the BHO or whatever the BHO, that's what they used to be. Whoever their new name is.
VHASO.
Yeah, the more letters. Their actions demonstrate commitment to addressing the opioid and fentanyl crisis. We are making strategic investments. This investment underscores our ongoing commitment to provide critically necessary behavioral health services to the region. So these initial funds will allow us to make immediate impact in the community, filling in gaps. Support and assist individuals impacted. Okay, but like doing what? Like all of that's so vague. Okay,
Yeah.
so let me see. Oh, wait. I've got a breakdown. Here we go. $5.2 million is going to a 23-hour crisis relief and sobering center expansion project. I have a question.
Okay. I mean, we do need
I mean,
facilities.
that's great, but why 23?
Oh, because
Is that the break time? Like that 1 hour? Nobody
it
died?
can't hit 24 hours because it turns into a whole different thing. I used to work at a
Uh-huh.
2359 crisis triage center.
Interesting. Okay, I didn't know that. Okay.
People have to be out before that time where it turns into a whole nother thing.
Okay. So $5.2 million towards expanding that project. There's a one-time capital investment, so the initial launch of 5 million and then $200,000 annual that will go towards it.
Okay. You know what though? I just realized like we're focusing so much money and time and energy on like being reactive to the problem. Why aren't we
Preventative.
addressing it at the source and
Children's
stop the
education
cartel from
Oh, yeah,
bringing it in?
that's really big. Yeah, that's
You know what I mean?
Yeah,
It's like we're trying
filter it
to
out.
put our thumb, in the dam.
Mhm. Correct. Yeah.
And this is what I mean by this is like big.
Right.
Like it's
And
not a
that's
simple
what,
solution.
and if you haven't listened to the earlier topic, do it because that
Do
one,
it.
your topic was really about the bigger cartel,
Like,
how
the
it,
source of it.
process, yeah. Cause they're
And bus. I talked about bus
Cause
too.
that whole like
Stings.
$200,000 a year, okay, that could go towards other things if this wasn't a problem.
Yeah. Now you're gonna get your potholes fixed.
That hasn't ever happened. $600,000 in long-term housing and treatment support for parents and caregivers of infants with neonatal abstinence syndrome. So, gosh, I didn't even think about that. Like how many little babies impacted. Yeah, no. So they're gonna do all 600,000 is initial capital and then
That's a whole other thing. The whole
babies of
unborn babies are not treated as humans yet, so a pregnant mother can use and use and use and use and there's no consequences. It's not until the baby's born that there's any intervention.
the consequence. Yeah.
And that is totally political
Oh yeah, absolutely.
because it ties into abortion
Right.
laws and everything like that.
Right.
So it can't be seen as like an actual
And with some of
person.
these drugs that are completely new, we don't know how, again, longitudinal studies, everything's connected back to the beginning. Longitudinal studies needed to know the long-term effects that it could have, or short-term effects on people's babies.
I feel like I don't need a study.
My guess is
I know that
shorter.
being exposed to
What do we say?
fentanyl in utero is
Less,
no bueno.
oh my gosh, yeah, less people born living less. That's what we said.
Or people born that need more support.
Yeah, that too, yeah.
More
More funding
and
and by typically
being
no
in the
fault of their
system,
own.
which
It cycles back
it
around.
can turn out okay, but sometimes it doesn't.
It can, yeah. $1.2 million goes to direct treatment. So again, intervention, expansion of behavioral health triage, sobering services. $200,000 annually to just other regional opioid overdose substance use tracking. So I have a question because many places, obviously not in Spokane, have what's it called? Where safe use facilities where there's like nursing staff or whatever to help if someone does have an overdose where everything's clean and stuff, and statistically like rates of deaths are much lower in those cities.
I mean, we have methadone clinic here,
Yeah, well, that's like a treatment center, right? Not a,
and it's a substance that's being safely
well,
administered.
well, they don't administer it, but they allow it, like it's basically a place where it's okay to, like, if you go in and use something, they'll have staff there, so if someone overdoses, there is a medical personnel available to help them.
I have no idea. It does not sound fun.
Well, no, but it's better than doing it on the street by yourself and not knowing if what you're doing is safe, like
Is that fun?
it is, like, if you don't have a fentanyl test and you're going to take your drug because that's your addiction, and you can at least have it tested to see if you're gonna die or not.
Yeah. I don't think we
I've
have
seen
that here.
Yeah, no, we don't. Uh, I saw this, it wasn't my topic, so I don't have information like right offhand, but I saw a couple of things that showed that it helped reduce overall overdose deaths in those specific cities that had the support, like it's like basically,
It's harm reduction.
yes, harm reduction. Thank you, harm reduction. This is.
I'm just thinking like back when I was a partier, hardier. Like I would not have thought it would be fun
There's a
to
difference between partying
do drugs in a
and-
facility being
and
watched.
being addicted to substances and houseless.
Well, when I was a teenager, I used drugs a lot. I was definitely addicted to weed for a time. 100%.
What do you think about people who say that weed isn't addictive?
They never walked a mile in my shoes.
The National Harm Reduction Coalition is one of the ones that does this.
I mean, they say it's not physically addictive. Like I wouldn't have gone into withdrawals, but
Right, well, see,
psychologically addictive.
and I still think there's like physiological aspects to it, but there's probably not just to the same level.
Yeah, like I wouldn't have like died.
Because there's like habitual things, like you're used to routines and.
No, I needed it.
feelings.
It was fully my medicine. I would be like Dr. Jekyll, Mr. Hyde,
Right.
on or off.
So harm reduction is supervised consumption services. So the Safer Drug Consumption Service is a designated site where people can use pre-obtained drugs, so they're under the safety and support of trained personnel. Over the last 30 years, SCS has been implemented across 100 sites in 60 cities in 11 countries around the world. And there's a whole website, if you Google them, harmreduction.org. It is an effective harm reduction strategy. Per their information, says contrary to one might assume, it does not increase drug use, crime, or bring drug use into communities, and it saves communities millions of dollars every year in preventing overdoses. It reduces HIV and hepatitis C transmission, reduces injection-related infections, reduction of public injections, safe disposal of syringes, and increases access to medical and social services.
Well, maybe they'll put some of that settlement money into creating one of them.
Yeah, it'd be interesting. I don't see that happening here just based on our the politicals, but I think harm reduction, not everybody is abstinence focused. So when you go to these places that is the only goal, like that may not work for people.
A lot of people.
Most people.
Well, we have a pretty liberal new mayor and a pretty liberal city council right now, so who knows?
Maybe, yeah. Yeah, there is a call. It says 64% of Americans support opening these centers, but they're not widely available. Great. So there you go.
It'd be so weird to work at something and like just watch somebody doing drugs.
That'd be hard, yeah. I mean, that'd be a hard job.
I would not.
Cause I mean, even though like, that's the thing is like, they, with like Narcan, it can help, but that doesn't mean someone won't die anyways.
Yeah,
Not like,
I couldn't do it. It'd be way too upsetting to me.
yeah, I was trying to find,
Luckily, there's lots of other jobs out there that are a better fit for me.
yeah,
Like literally any other job.
like, I still sometimes think back to when I worked at KFC, how peaceful that was. Just like I could show up, I knew what my tasks were, and I
And
left,
you leave it.
and you leave it at
It's locked
KFC,
away.
you just put it in the bucket,
Leave it in a bucket
mix it with your
with
hand,
the secret recipe.
tong water,
How many ingredients are in the secret recipe?
I don't know, it's a secret,
You told me before.
did I?
Yeah, a certain amount of spices.
Was that like 10, 15 years ago I told you the secret recipe? I don't remember
I
that.
mean, like, you didn't tell me the recipe, but you told me like how many like secret spices were in it.
That's memory, the memory is gone.
It's gone. One day it's in there somewhere.
One day I'll be like, oh yeah, I did know that.
Yeah, and you'll just spout it off.
I spat it all over the place. I'll be like, whoa, didn't know that.
Easy there.
Whoa, KFC knowledge coming at you. First time I had to make mashed potatoes. One, I had to wear the like horrible, what's it called, the like uniform. That was like all black and with a red top, but the pants were way too big for me. So I had like these baggy black work
Is it
pants.
polyester?
Yeah, that kind of fabric you don't want on you.
It's flammable.
Yeah, and I
It doesn't
didn't,
breathe.
yes.
Are the mashed potatoes like a flake that you
Yeah.
rehydrate?
Yeah, so they give you, I had like this big, okay, these might be trade secrets. I have no idea. I could get sued for
Did you
this.
sign an
but
NDA? I'm sure it expired by now. I think you're good.
No, and yes, I was a child as well. I was under,
Yeah, you
18.
could say you didn't have the ability to make an informed consent.
I don't think I signed, I'm sure that I did. I don't know. I worked for the colonel. So, it was a big, like, I called it a trough, but it was like a giant mixing bowl. It was like this big, at least. And they have like this big industrial mixer thing. But yeah, you dump in like bags of the powdered or flaky, more powder than flake. And then you pour in their like the fluid, is what I'll call it.
It's not water.
No, it's like a butter mixture. It's like that fake butter mixture. So you only put one thing in and it's that.
Okay.
So I'm sure there's water in it.
It's like a water butter.
I doubt it's butter either, but it's like a water gasoline oil.
Butter
Just
flavor.
kidding, I don't know that
something.
for a fact. Yeah, and you just pour it in there. And then you and this again it could be very outdated too. Could be outdated. And then you put it in, and I didn't know how to use an industrial mixer because I was a high school student and didn't receive quality training from the other high school students who worked there. So I had to put it in, and there's this thing like where you have to like kind of like lock in, it goes down deeper into it. So it doesn't fling mashed potatoes.
Equipment.
Yes, and it flung mashed potatoes across the walls of the KFC.
Oh my
all
God.
over my white pants.
You had an industrial mixing accident.
Yeah, the coleslaw, I actually liked the flavor of the coleslaw, but it bothered me more because it was actually in like these totes. It was like totes with garbage bag liners.
I don't like it when they put food in garbage bag liners.
Me neither. It was
Even
not
though I
scented,
know-
not scented.
I
but
know it's sanitary, it doesn't feel sanitary.
no, and we did wear gloves, but you put gloves on, and the way that you mix it was with your hands. So that's the best way to mix it. So you'd big things of the cabbage mix that you probably get at Costco, and then they're like creamy or whatever. You just
Creamy whatever.
pop it, and then you have your gloves on, and you just hand mix it around in these bucket troughs.
I think what it is since it's a garbage bag, I can't get rid of that association,
With
and
garbage.
it makes me feel like the food is now garbage.
Correct.
You should have done it like how you like squish grapes, like get barefoot up in a tub and have a fun dance. You know what I mean?
No, you can do that. Like, it's a tote.
Oh, the tote, my goat.
So I'm sure I'd step on it, it'll squish around me like coleslaw.
Do you still eat at KFC, or is that like ruined for you?
It was the learning how to break the chicken wings that
Oh,
kind
yeah,
of freaked me
yeah.
out. Yeah, cause That, I don't like that. I can do it now actually, and I can clean a chicken pretty well, pretty dissociated from it. We became a Long John Silver's combo at one juncture, and so then it also became planks of fish, and then I realized,
Oh, that's seafood.
yeah, and I was like, I didn't know fish came in planks.
Hmm.
It doesn't, it's just, it was like a plank that had like pre-cut creases of a shape of a fish.
It went through something before it got there.
Yeah, and then we'd have to like break it
Had an
up.
experience.
Yeah, yeah, I like the hush puppies.
What are
Cause they're
those?
fair, it's like a southerny thing, like a, but it's basically a cornbread.
Oh,
And
I like
oil,
cornbread.
yeah, and it's just like a fluffy cornbread, like a biscuit. And I like those, and their apple turnovers, bomb.
Mm.
And their popcorn chicken, if fresh is good, if not fresh, don't be like, ooh, this is a little chewy, but it's okay. It was there for hours, and it all sits under a heat lamp. So when it's busy, that's actually better. You get higher turnover of
Mm.
cooked food. When it's slow, that means it's probably been sitting there. So, pick your battles.
So do you still eat there?
I have to be, it's a rare occasion. Um, and it would only be to get the famous bowl that I took issue with because it came out when I first started working or when I worked there. And it was called the famous bowl.
Well, all you do is
It
call
can't be
somebody
famous.
famous and then it's famous.
It can't be famous if it never existed prior to that moment.
You know what? I made mashed beans and I called them my famous mashed beans,
Huh.
and now
They're
I branded them and everybody refers to them as my famous mashed beans.
right.
They were famous from day one.
I mean, and so I refused to eat it that whole time I worked there for however long that was.
You had a
Almost 2
grudge
years.
against the
Yeah.
famous.
So, and now I'm like, I kind of like it, but I won't admit it because it has popcorn. So, in case you're not familiar, it's the mashed potatoes, the gravy, but well, you do mashed potatoes first, and then you do a scoop of corn, which is where I'm already like in real life, I would never mix my food like this. I don't know, it's weird to me.
Okay,
And then gravy,
okay.
and then, or sorry, popcorn chicken, then gravy on top of all of it.
Sounds like a stoner mess.
Yeah, so it's like I have to be in the right mood to like somehow crave that. And I think it's because it was like the forbidden fruit back in the day.
It's famous.
But I will get an apple turnover because it's actually 2 for the like price of one.
Watch, you're gonna go there on the way home.
Damn
It's
it.
gonna spark a craving.
I'm thinking about, because the nice thing about their apple turnovers is they have that nice flaky like crispiness.
Nice.
Yeah. Never piss off your fast food worker. I'm just saying, like real life, just don't do it.
No, I don't like doing that at any restaurant because they could do anything and I wouldn't know.
And nowadays, it could be fentanyl. So just know they could,
I'm
laser
usually
fentanyl.
worried about bodily fluids of some kind or another, or just stuff falling on the floor and just being picked up and put back on my plate.
Oh no, that would happen. Again, most of the time it's either young kids that don't care and they're just there for a paycheck, which, yeah, or they're people that are there who may not be of that age group that are really angry and bitter about having to work with a bunch of high school kids, or it's people who are genuinely good at their jobs who should be paid more. Like, and so to me, none of those scenarios works out.
Damn it.
Poor Mike, we had such a great manager. He was so nice when he was the one that hired me. And he ended up getting let go and they promoted this one lady. I did not like her nasty, nasty attitude all the time.
Your attitude is your choice.
Yes.
Anything else on fentanyl?
No, I think I left it at whatever last point I left it at. It's gone forever now.
I feel
And
like
it's still a problem, and
Yeah.
Oh yeah. The money is. Oh yeah, I want to see where your taxes go. But keep going.
No, but I feel like this is a topic that is not a 1 or 2 and done. Like it's
No, there's
so
more.
apparent. It's such a part of
I want to see how these
daily
things-
life.
Yeah, it's like the North-South freeway. I mean, ultimately, will this money that they're putting, like throwing at interventions, is that going to actually do something lasting or not? Probably not.
I don't know.
They need to get the cartel.
And there's so much money that, the cartel is making that if for some reason fentanyl becomes eradicated, that, you know, it's just gonna move on to something else, I'm sure. Because it's money,
And
powerful money. This
power,
is like money.
power, money and drugs.
This is like big money. This is not
Yeah, and if you get
$1 million.
anybody wealthy involved in that, then you get sex islands on top of it.
This is like what I told Stella earlier, infinity billions.
Ooh, yeah.
Because I was trying to think of the most amount
That's a
I
good
could
one.
think of.
Infinity billions
Yes,
worth of problems and taxes.
yes.
Okay, are you ready?
Yeah, bring it on.
Okay. Do you want this Spokane 2023 tax breakdown for Spokane County?
Yeah. Where's my money go? My hard-earned money.
All right, here we go. Sorry, the first thing is they make it confusing. Spokane tax rates, we don't care. Wait. Spokane County sales tax breakdown. We don't want sales tax, right?
No,
Revenue sources, historical budget documents. Why is this not helpful? Immediately not helpful.
they probably don't want people to dig into it too much. It's like trying to unsubscribe from something. They make it so difficult that you just give up.
Anyway, I think I found the okay, here's a quarterly report from the Spokane City Council. I have to actually download a file, which either means my phone's gonna explode.
Do you know that I recently found out that I'd been paying for 2 Microsoft Office subscriptions?
I did that recently too.
And they
I think
could have reached
Audible.
out and told me, but instead they took my money for like 10 years.
I am so upset from the state licensing for my business, they changed, so I had to renew. And they sent the renewal notice in February for June, so that's a long time. No reminders or anything in between, and then they changed their policy where but they changed it after that due date. That you would have to resubmit your entire application again, but they didn't tell anybody that.
No.
And it's like, why don't you like tell people ahead of time when you're gonna change something that like is a lot of work for people?
They don't tell anybody anything.
Don't tell anybody anything anymore, ever.
No.
Maybe they never
My
did.
rates of everything has gone up recently. Everything.
Everything.
My car insurance, homeowners insurance,
My
property
Avista
taxes.
bill,
My Spotify
my
is
Comcast.
now $19.99 a month for our family plan.
Psh.
I got rid of Netflix
Oh yeah, I should probably do that too.
because I was only watching one show on there.
Did you know? Okay, so revenues 237 billion? No, $1 million. Just kidding. $1 million. Yeah, and whatever change. The budgeted revenue was 105 and change. Expenditures was 240 million. So we were over expenditures to revenue. So we spent more than we got.
Mm.
I wonder if that's because of taxes. So variance was 1,900,946. Okay, here's the changes to the adopted general fund budget. General revenues, fund, BTs, SBOs, they don't even tell you what these are.
Well, I'll do some more research because I'm actually
Ooh,
curious.
I found. Non-departmental, city clerk, human services. Okay, here's your breakdown right there. I'm gonna screenshot it and I'll send it to you.
Thank you.
You're welcome.
I did my research.
Yep. And until next time.
Just give up on that north-south freeway. It's never gonna happen.
Yeah, look up some Washington resources for Narcan is, even if not for you, for someone else.
Give 4 or 5.
4 or 5 down.
You have to order them separately though.
Correct.
Because
And
they only send you one at a time. That's what I mean.
yeah,
You only get one at a time. So you have to order it 4 or 5 times.
right. And if this is new to you and you had no idea this was a problem, roll down your window, look out.
Hold down your kitchen, so.
Look at the people pooping in your yard. Oh shit. Bye.